The humanitarian crisis in Yemen remains the worst in the world, and the severity of the need is deepening. The conflict remains the key driver behind food insecurity in Yemen, a country with the highest level of food insecurity in the world. The situation has worsened access to food for both internally displaced people and host communities who are already vulnerable. 53% of the population are severely food insecure, and this is with all the support provided through humanitarian assistance. Without that support, it could increase to 67%, out of which 240,000 people are at the verge of famine. Conflict has deeply affected food availability in Yemen. It disrupted the normal livelihoods of the people in Yemen. Prices hiked tremendously, and this is due to partial or complete closure of key ports, and farmers, due to airstrikes, are no longer feeling safe to go to farms. The government structure has reduced in terms of capacity. Food insecurity is more severe in areas with active fighting. Women and girls are most affected given their vulnerability and how they are affected by power balance in their society. It also particularly affects marginalized groups, internally displaced people, and host communities. Food insecurity is linked to health. We have witnessed increase in the number of severe malnourished under 5 children, as well as pregnant and lactating women. So families are losing their children. Not only that, they are incurring very high costs to treat their family members at the cost of their food needs. Aid organizations are working together with the UN and other donors on scaling humanitarian assistance through general food distribution, cash and voucher, as well as livelihoods restoration. They're also working on scaling up acute malnutrition treatment and prevention, but despite all these efforts, the need is tremendous.